I want to introduce you all to a new face, as this likely won't be the last time that he joins us for one of our public updates. That's Dr. Wayne Duffus, MD, PhD, a trained epidemic intelligence service officer with the Centers for Disease Control, who has led multiple initiatives within the agency, most recently as a senior medical advisor in the CDC's Division of Global HIV and Tuberculosis. Dr. Duffus has stepped in at IDPH as our acting state epidemiologist and has primary responsibility for our contact tracing initiative. I've talked before about our ability to test and trace and how critical it is as we move from our stay-at-home order towards a new normal. The importance of testing has been a major topic over the last few weeks, including yesterday. So today's focus is on that second T, tracing. Tracing, or contact tracing, is one of the most critical tools that we have to reduce our spread rate, speed up our diagnoses, and seek to halt outbreaks before they happen. But let's start with the basics. What is contact tracing? Well, it means making sure that you get notified if you've had contact with someone who has tested positive for COVID-19, so you can do what's necessary to keep you and your family and your community safe. Contact tracing means we will let people know before symptoms start that they could become ill. In the context of a very infectious virus, this is our primary tool for identifying potential asymptomatic spreaders so that they can self-isolate quickly and slow the spread of the virus to their contacts, keeping more people COVID-free for longer. And that last factor is key because it demonstrates why contact tracing is so important to all of us together. It means a reduced rate of spread, fewer outbreaks, and an all-around healthier Illinois. Contact tracing isn't a new concept. It's been around for many years, and Dr. Duffus will talk a bit more about that history. The difference now is that in order to move safely back toward normalcy, Illinois, the United States, and frankly the whole world must contact trace on a never-before-seen scale. Contact tracing has played a role in our COVID-19 response since the earliest days of this pandemic, as local health departments around the state have aggressively sought out each COVID-positive person to identify all their close contacts and then encouraging those contacts to opt into monitoring programs and to follow recommendations. That was when we had a manageable number of cases and contacts that county health departments' existing staffs could handle. Of course, as we all know, over just the last few weeks, COVID-19 has reached a massive scale of spread statewide and nationwide, and existing public health management infrastructure simply can't keep pace. No doubt, as we all live through this pandemic, I think we'll all have a lot to consider about our failure to invest in public health in this country, but we'll save that conversation for another day. Right now, we have to deal with what's right in front of us, and that's getting to the other side of this crisis. Here in Illinois, we've had more than 50,000 known cases to date, largely in just a 60-day time frame. Their contacts are 50,000 sets of family, friends, coworkers, commuters, classmates, and other contacts. It's an unprecedented public health challenge, so we need an unprecedented solution to meet this moment. To do that, Illinois will be building on our existing infrastructure and expertise to shape a massive statewide contact tracing operation, gradually building over the coming weeks, and then scaling up an army of contact tracers by the hundreds and then by the thousands. Right now, based on our current rates of spread, we're looking at a benchmark that could approach 30 workers per 100,000 residents. But to be clear, that number can and will diminish if we see greater success in our public health measures, particularly our new face covering requirement. Already, we've identified groups of Illinois residents quickly willing to scale and be part of our efforts: undergraduate and graduate students, volunteers, retired health professionals, local health officials, community health workers, and new hires. And if you're interested in being a part of that, keep an eye out for more information on how to get involved in your community in the coming weeks. A significant part of this program involves technology. When an individual tests positive for COVID-19, a contact tracer will reach out to them through an app, through email, a text, or a phone call. And because not everybody can or will use technology, some will require follow-up even with a safe in-person visit if the COVID-positive person can't be reached in some other way. Then step 2. Interviewing the COVID-positive person, asking them to gather their contacts and retrace their steps over the past 14 days. This is what allows us to significantly slow the spread of the virus, because connecting with those who've been exposed allows us to do 3 important things. 1, notify them that they've recently been in proximity of someone who has tested positive. 2, recommend that they seek a test and self-isolate. And 3, offer them resources on how to access any needed assistance to prepare them for self-isolation, things like alternative housing, food delivery, or medication. Privacy is an important aspect of maintaining trust in contact tracing. So to be clear, contacts will remain anonymous. Looking backward and pointing fingers doesn't help anyone in this situation. It's about what we do next to keep each other as healthy and safe as possible. Remember, we aren't reinventing the wheel here. Contact tracing has been done in every pandemic and major outbreak for many years. In fact, that's why Dr. Duffus is an experienced expert at it. And in a moment, I'll ask him to talk more about our efforts to build out contact tracing in Illinois. Finally, I want to take a moment to recognize a very extraordinary group of people. Today, the Illinois State Police, consisting of the finest troopers in the nation, will be welcoming 92 cadets into their ranks. 92 cadets who completed their training in the midst of a global pandemic will take their oath and join the ranks of our proud Illinois State Police. As these are unusual times, so too is this milestone. For the first time in the 98-year history of the ISP, there will be no graduation to celebrate the completion of their training. For the first time, there will be no class picture, no speeches, no family in the audience proudly watching them as they cross the stage and take their oath. And in the very act of accepting their mission in this way, at this time, these officers, these troopers, are launching their formal careers as members of the Illinois State Police as they will live it, in great service to us all and great sacrifice. When I became governor, I committed to rebuilding the ranks of our Illinois State Police, and these 92 cadets are helping fulfill that commitment. It's an investment in public safety that will serve the people of Illinois far into the future, long after this pandemic has passed. So to the newest members of Illinois' finest, God bless you and your families, and God bless the great state of Illinois. And thank you. I'd like to turn it over now to Dr. Duffus. Doctor.
Good afternoon. So what is contact tracing? Well, contact tracing for communicable disease is a core public health activity that has been practiced since the early 19th century. In the context of COVID-19, it is the process of following up with contacts who may have been exposed to a person with suspected or confirmed infection. Please note that local health departments have well-trained staff who utilize the principles of contact tracing daily in their work. They use it to perform partner notifications for diseases such as HIV, syphilis, and tuberculosis. And this makes our local health departments the ideal core essential partner to serve as the hub of our activity in Illinois. How does contact tracing work? Well, our governors quite clearly described how it will function in Illinois, but there are some things I wanted to emphasize. The issue of privacy. To protect patient privacy, contacts are only informed that they may have been exposed to a patient with the infection. They're not told the identity of the patient who may have exposed them. Another essential aspect of our contact tracing program is that contacts will be eligible for testing, and if that test should return negative, then they could be released from isolation. So how has Illinois conducted contact tracing to date? Well, I want to be clear that from the very beginning, local health departments have actively attempted to follow up and interview each case as soon as possible and identify all close contacts, including those from the home, healthcare exposures, and employment. Early in the pandemic, IDPH alerted local health departments as soon as tests were positive, and the local health department attempted to contact cases upon receipt of those results. The case was interviewed to determine onset and movements, and then all contacts identified from the date of onset and 48 hours prior to onset. Those deemed to be close contacts were asked to self-quarantine, and cases were isolated. Contacts are quarantined for 14 days from the date of last exposure. Contacts can choose to be actively symptom monitored by being contacted by the local health department 2 times a day, or by receiving an email or text from REDCap, which stands for Research Electronic Data Capture. The local health department can monitor compliance and presence of symptoms in REDCap. The local health department also communicates with the case and the identified contacts placed in quarantine and educate them on how to safely isolate, quarantine at home. The local health department will address any needs for provisions such as food, laundry, medication, if no one else is available to provide those services. So, as the number of cases increase over time, we have responded by developing a hub and spoke model, plan of action. The core will be the local health department, who will provide oversight, localized strategic direction, leveraging relationships with local community partners, and the spokes, for example, federally qualified health centers, community health centers, will provide deep community connections, teams of trusted messengers, and they have the ability to be very responsive. The umbrella of the hub and spoke will be the state, and the state will provide for consistency across several areas, including resources, curriculum, and technology, for example. Why is this important for the current COVID health crisis? Well, it is how we break transmission, and it's how we make sure that we don't have a large outbreak ongoing. Given the magnitude of the COVID-19 cases and plans to eventually relax mitigation efforts, such as stay-at-home orders and social distancing, communities need many trained workers. These contact tracers need to quickly locate and talk with patients, assist in arranging for patients to isolate themselves, and work with patients to identify people with whom the patients have been in close contact, so the contact tracer can locate them. Fortunately, in Illinois, we're very resourced in terms of having experts to help guide us in this. So we're working with modelers from the University of Illinois, University of Chicago, and Northwestern, who have used simulation models and simple assumptions around key contact tracing parameters to approximate the daily number of caseworkers needed to perform contact tracing through the duration of shelter in place. Just to be clear, the actual number of staff needed is large and varies depending on several factors, including, but not limited to, care-seeking behavior, the daily number of cases, time from symptom onset to testing, the number of contacts identified, how quickly patients are isolated, contacts are notified and advised to stay home, self-monitor, and maintain social distance from others. And since these numbers change daily, certain assumptions are made in the calculations. So, for example, current prevalence, we assume that a staff works 5 days a week. We assume that a staff can make 20 phone calls each day. We assume that caseworkers will have 4 days over which they need to identify contacts. And this is a nearly optimal situation in which tracing begins 2 days after symptom onset, which is approximately 4 days after infectiousness. We assume each index case contacts 2 to 3 unique people per day. And this number would rapidly increase when shelter in place ends. For every positive test, there are 4 negative tests based on current cumulative test positivity rate of 23%. So the test needed is equal to the number of true symptomatic cases times 5. And this actual ratio is likely to rise once testing is further expanded. So in reference to the governor, we are using a benchmark of 30 workers per 100,000 population. Illinois has a population of 12.7 million residents approximately. So doing the math, 12.7 million divided by 100,000 gives 127. If the benchmark is 30, you multiply that out, you get 3,810 individuals as our estimate of how many individuals will be needed. However, note well that these individuals do not have to work continually because we're driving down the numbers testing positive because of the continuance or adherence to non-pharmaceutical interventions. They do not all have to be hired all at once, and so the numbers speak to the total over time. It is also very reasonable to start with an initial number, say 10% of that total, say 300 workers, but they're strategically placed in the regions that are most impacted. By working with the many individuals and institutions which I'll detail below, we will have the capability to surge as needed. Think of how we use the National Guardsmen. Think of this as a dial and not a switch. Also, by deploying technology as a first contact with individuals, the number of workers needed will be fewer. We plan to implement a virtual call center, which will enhance efficiencies, and only the most hard-to-reach individuals will actually require a visit. So imagine a homeless individual, someone with no connectivity, or a very ill person. To always be on the leading edge of the pandemic, we've organized the IDPH staff into a command center of subject matter experts who are tasked with reviewing data daily and be ready to make recommendations based on chosen indicators of success, the umbrella. So who will be engaged to assist with contact tracing in Illinois? So contact tracing is a skill that can be performed by anyone who's bright, interested, and has a charming personality. We will hire people from every region of the state using mechanisms that are fast and enable quick onboarding. The core personnel for contact tracing efforts lies in 3 cadres. First, case investigators. These are the individuals, staff who reach out to individuals who soon after test results are reported as positive. Second cadre is contact tracers. They will call individuals who have been in close contact with a diagnosed case and ensure adherence to protocol and follow up as necessary. And the third cadre are resource coordinators. And these resource coordinators provide individuals on quarantine or who are isolated with the relevant resources and support to facilitate compliance with our orders. So food, medication, alternate housing, for example. So where are these people coming from? Well, we've heard from a lot of people who are interested. Professional contact tracers at local health departments, professional contact tracers from federally qualified health centers and community clinics, reassigned workers at local health departments, reassigned workers at federally qualified health centers, skilled community members such as community health workers, social service professionals, and other allied professionals. We have heard from recent graduates and students from public health training programs as well as allied health professional training programs. We have volunteers from Illinois Help who are interested, and there are also established as well as new training programs at regional training centers. To be done effectively, it requires people with standardized training and scripts, supervision, and access to social and medical support for patients and contacts. So what are some of the additional needs for contact tracing? Well, communication with the public is essential. To be successful, a community will need public awareness and understanding and acceptance of contact tracing and the need for contacts to separate themselves from others who are not exposed. Community members need to take responsibility to follow the guidance from public health agencies. Data management and technology is needed. Case investigation, contact tracing, contact follow-up and monitoring will need to be linked with timely testing, clinical services, and agile data management systems to facilitate real-time electronic transmission of laboratory and case data for public health action. And finally, ongoing monitoring and assessment of contact tracing efforts will be needed. public health agencies and their partners will need to monitor some key components of their programs to improve performance as needed and to determine hotspots and vulnerable populations at risk.